God Almighty who has sustained our lives, given us health, the means and wherewithal to live from day to day. Today we have a health talk. It's a program we conceived of about 2 months ago. But for some reason, we couldn't implement it now. The program essentially is about men, and the wives need to know. It is a condition that affects men usually as they get older. These days, we are beginning to see from age 35. The doctor will give us more explanation. So from 35 to 40. So why is this problem there? What is the problem? It is a sensitive topic, and it is usually what we don't discuss because it affects a sensitive organ of the body. So we are going to request you, if you have questions, write them. If you don't want to write, you are free to stand up to ask. But some of the questions you may be shy to ask as a sister, and you know when you ask that question, say, maybe if brother be like that, so that's why you talk like that. No. We are here to learn. You may not have experienced it yourself. You will know about people who have experienced it. So, educate us here today. He is a senior medical officer with the Unilag Health Center. This is a people's doctor, very well known at the University of Lagos. Is somebody that is humane, is a doctor, medical doctor trained with very many years of experience, but is very pragmatic and practical. Anytime you meet him on the way and you have a challenge, you ask him, we will discuss it with you and advise you to come. Well beloved, in the Unilag community, brothers and sisters, friends, let us welcome Dr. Mike. So, please, Dr. Kwaba, the platform is yours. You're welcome. Sorry. Over to you.
Good morning, brethren. Good morning. God bless you all. My name, as I mentioned, David Ekwaba. I think it's going to be an interactive section. It's not the amount of saying take questions. I want to commend this church because as I was sitting at the back, I looked at the notice board. I could see some health matters there about Lassa fever and then coronavirus. That shows that this church is health conscious, and it's quite important. Yeah, why prostate? I don't know why prostate. Maybe you could have other thoughts. But why prostate? One would have thought that, okay, churches usually call for maybe hypertension down, maybe the ones that will cut across, male and female. But this prostate is very important. And more importantly, I want to thank the church for allowing everybody to be around. Because there's a woman in every man's life, and there's a man in every woman's life. So this prostate we are talking about is only in men. and the location is very hidden. That's why we have to pay attention to it. It's usually between the rectum, that's through where the feces eventually passes out to the rectum, and the bladder that holds your urine before you are pressed to pass it out. You can do where you squeeze this. And so it's a big challenge. For women, I mean, we would have heard about self-breast examination, at least you can touch it. But this one, even the owner cannot touch it. They don't even know where it is. So it becomes like a big issue. And so a lot of people that present usually present very late. At which time maybe it has spread. Because if you don't, screen and find it in time, you might find out that it can spread. Especially when it gets to the bones, you see the person complaining of low back pain. So it's not all low back pains are probably very attention or this thing. It's not all low back pains. Sometimes low back pains might be, that the person might be having complications from the prostate. Now, the prostate has 3 different angles that it can give problems. It can be infected, what we call prostatitis. It can also enlarge, what we call, that's maybe one of the commonest ones, what we call benign prostatic hypertrophy. It's a big word, but what it means is that the prostate is enlarged. The normal prostate starts growing. By the time the person is 20 years, it has gotten to its maximum size. By the time the person is entering 40 again, it starts getting bigger again. So like Prof said, sometimes you find that for people in their 40s, start manifesting gradually. 50s, as they are advancing in age, is becoming more problematic. But the prostatitis, like I said, is the infection aspect of it. Usually happens to people below 50 years. And the usual symptoms, when you have somebody visiting the loo, passing urine too frequently, sometimes there might be pains when they are passing urine. Sometimes they might see blood in urine. Sometimes there might be pains around the ends or what looks like heaviness. And sometimes when some people, I don't want to restrict my word, these are my short people. When people ejaculate during intercourse, they might feel some pains, So these might be signs of infection of the prostate. But the enlarged ones, from 40 years, you find out that the prostate starts enlarging. By the time most people are getting to 60, by the time they are getting to 60, almost 50% of men might have their prostate enlarged. By the time they are seeing, we are living longer now. Actually, we are living longer. There was a time in those days that you see, especially men, hardly close to 60, 70. But now you find that, the retirement age for professors in the university is 70 years. Even at that, when they are retiring, some of them, quite healthy. So the life expectancy is improving. So there are some issues that come with this increase in life expectancy, and prostate issues is one of them. Now, what are the symptoms of this enlarged prostate? Some people might complain, when you are young, you wake up as a man in the morning, the first thing you have is erection, when you are going to eat. And sometimes you can pee from here and the thing might hit the wall. You know what I'm saying? Yes, very projectile. But by the time the prostate is getting enlarged, it causes some obstruction to the flow of the urine. So you find out that as you are moving, it's almost dropping on your shoe. You can't go far again. So you have to watch out for that. You have to also watch out for, going to pass urine too frequently. And sometimes when you go, you might feel the urge and let me rush, and you just get there. Something that you were rushing before, you get there, you now have to wait for the thing to come. Sometimes you start trickling, you know, and sometimes even when you finish, it's as if feeling of incomplete empty. It's as if something, there's still some left. When you finish wee-wee, sometimes if you are not watchful and you think you finish and you pack, you find out that you wet yourself, but it's still some drumming. You know what I'm saying? So these are some of the things, you know, you will notice. And if you become so enlarged, you find out that you might start straining. You are wee-wee, and it's as if you are in level. They are screaming, you know. Sometimes it will just push. But what gets most people worried is that one day you might find out that the bladder is full, the urine cannot come out. Nothing is coming out again. You try whatever techniques, it's not coming. And it becomes an emergency. You know? So you find out that you get to the hospital, they now have to put what they call catheter, like a pipe, to drain the urine. But you can imagine if you are in a village where there is no health facility, and you have this kind of challenge. That's why you have to tackle it early. You know? So that is very important. It's just here, but one aspect also that is very disturbing is the cancer of the prostate. The difficult thing about this cancer of the prostate is most times it doesn't meet any sign. No sign. But it's there. And that's why screening is very important. I don't know how many of us here have checked what we call PSA, prostate specific antigen, in the last 1 year. Okay? Few, you see? Very important. You wouldn't know if you are waiting for signs, you see? You know, if this malaria fine, you have headache, you have fever, but your hand they are shaking, somebody will know that. Let's rush him to the hospital. With this one, you might not have any sign at all. And it's not that. And most people with cancer of prostate, by the 65 and above, we say most. It doesn't mean you can't find it in people in their 50s or 40s. But when it wants to give you sign, I said no sign at all in most people. When it wants to give you sign, the sign might be, you know, going to the toilet to pass urine frequently. It might also be, you know, straining to pass urine, difficulty in passing urine, you know. So it's important that you note that, look, this thing might be there and it's not giving any issue. Now, what are the risk factors? You know, most cancers, you can't really say because that's the challenge. You can't really say this and this is because. So we talk about risk factors. Things that you will see or things that will, you know, raise the red flag or yellow flag, whatever, and you have to be careful. Family history is very important. But you see, in this environment, we have, I don't know, try and beg their parents when they are alive. But some of them will tell you that when they die, don't take them to the mortuary. And it's when you do autopsy that you know the eventual cause of death. If you don't do autopsy, how are you going to know? So most people don't even know diseases that run in the family. You know? So, family history is very important. If your father or brother have prostate cancer, that means you are 2 to 3 times more likely to have it than the general population. You have the high risk. If you have anybody in your family that is diagnosed with prostate cancer, when they are less than 60 years, 3 to 4 times you have the likelihood of developing cancer. Mother, if your mother had breast cancer, it's possible you inherited a carcinogenic gene, you inherited a gene for cancer. So it's important. Even those people, they are 5 to 7 times more likely to develop cancer of the prostate than in general population. Being black, what I mean, Africans, black African, it's more common among blacks. So blacks are 2 to 3 times more likely to develop it than the general population. And their weight is of importance. In Africa, if I tell people, oh, you need to scale down your weight, they said like this, you want me to disappear? What I tell them is that even myself, I'm overweight, which is true, I'm still working on my weight. They say, you like this? I say, yes. The importance of the prostate, because somebody will be asking, why is it there? Of course, it's producing seminal fluid, which is a component of semen. You know, when the man is meeting the woman, that fluid that really accompanies the sperm is from, you know, the prostate. So that's the primary function of it. Yeah. So we've gone through this, the common problems, infection, that is prostatitis, the enlargement. This is what. You see the enlargement. On the left is the normal one. Can you see my arrow? That's the through where urine passes.
Yeah.
This is the bladder. So this is the bladder. And when it's full, the urine will pass through the urethra, through this pipe. You can see how narrow it is. And this is the prostate. You see, on the 2 sides, just surrounding the pipe through which urine passes. And you can see here, that's when the prostate starts enlarging. You can see that you find it difficult to find that pipe through which urine passes. So it occludes it, you know, and it becomes a problem. I say at 60, about 50% of men might have enlarged prostate. By 85, close to 90% of men might have an enlarged prostate. And this is the demonstration you see. Somebody without prostate issues, you can see how projectile the urine is going, you know. Unlike this one, he appears to be having pain, and you see the urine dropping very close to the legs, you know. When it comes like this, you know that, oh, there might be something going on with the prostate, and the person will surely need to be investigated. But you don't need to wait till it gets to this level. It's something that, you see, annual checks is one thing we don't do in this country, but I know that the awareness is creeping in. You know, you need to do annual checks, or every 2 years. Go and do checks. Don't wait till when you are ill. Don't wait till when you be rushed to the emergency. You know? So do annual checks. What is that? Okay, I'll check my blood pressure, I'll check my blood sugar, I'll do my cholesterol, I'll do my prostate, do the scan to see whether it is enlarged or not. You know? So that's the beauty of it. Well, by the time you wait, it gets to this level, the level whereby you have retention, whereby the urine will not come at all. This is what you end up with. You know, catheter, you see the pipe, they are inserting into the penis. So as to leave the urine, it can be very painful. And God bless you if you have hypertension and you have acute urinary retention. The pain you have, you know, pain can give you shock. That's what we call pain shock. Pain can give you shock. Okay. Alright, you know, and if you have high blood pressure already, and you are having urine retention with the pains, what happens? Your blood pressure is going to shoot up very, very high. Even people without high blood pressure, by the time they have this pain, acute urinary retention, and they are in pain, you see the urine, the blood pressure going so high. And somebody that has hypertension, it might tip you into stroke. You know what I'm saying? So it's important you don't wait till you get to this level whereby they will start connecting pipes, to relieve the urine. Like I said, you can imagine if you travel and there was a traffic on the road and you came out to urinate and the thing refused to come. And there's traffic and there's no hospital around. You can imagine the kind of trauma you'll be going through. So don't wait till you get to that level. Okay, we are talking about cancer. Apart from skin cancer, it's the second killer, second most frequent cancer in men. And most men are above 65 that have cancer of the prostate. But you see, it doesn't mean that people in their 50s and 40s don't have it. But once most people hit 65, the incidence tries to grow higher. And age is a risk factor, so the older you become, the more likelihood you might develop cancer of the prostate. And the commonest complaint they are being difficulty in passing urine, and also straining and sitting the loo frequently, and also passing urine so many times at night. That's the nocturia. The prostate, that's one thing. Prostate might appear normal. That you did a scan and they say your prostate is normal, but some mean that there might not be likelihood of cancer there. So you have to do the PSA. You know what I'm saying? Check the prostate specific antigen to see how high it is. It's very important. If you've not done yours this year, please make arrangement and do it. And do it from a very reliable place. The risk factors, I was saying that most cancers you can pinpoint this and this and what, is the cause. But you can talk about the risk factors. And we mentioned the family history, father, 2 to 3 times more likely. If any of the relation is diagnosed in less than 60 years, 3 to 4 times more likely to develop it. And the general population, mother with breast cancer, there's this gene. Possibly you inherited it, and it stands a chance of 5 to 7 times developing it in the general population. If you're African, which all of us are here, 2 to 3 times more likely. Obesity, it's difficult to find people that are normal, that have normal BMI. How do you know whether you're obese or not, or overweight? Know your weight in kilograms. Find their height in meters. Most of us are 1 point. Height in meters should give you 1 point something, 1.7 something. I'm 1.77 thereabouts, So if I use my weight in kilograms, that height in meters square the height in meters, use it to divide their weight. It should not be more than 24.5. If it's more than 24.5, you are overweight. If it's more than 30, you're obese. I'm overweight, so I want you to use me to compare yourself. I'm overweight. So, high calcium diet, anything that you get from calcium, so please watch it. A lot of us on calcium tablets, you say you want that wants to be strong. But you know that you are pumping so much calcium into your growth and know the consequences later. So don't just be thinking of your bone being strong, think of also your prostate. So the average age and diagnosis is usually 70 years, the average age, Okay. So there is a way of checking your prostate, but it's worrisome to a lot of people. Remember I said that the position is not a place that is easily accessible. So if I want to check prostate now without saying go and do scan, that means I will wear gloves and lubricate it so that it won't be painful to you, and then you will lie down, I'll put my finger into your nose and go deep just to feel your prostate. You know what I'm saying? Sometimes most people don't like this procedure. And it's not as if it's so accurate. In fact, by the time you massage the prostate a little, the person might even go away on himself. So you're looking for hardness. Is it hard? If you could do it with experience, you'll be able to keep that. This is slightly problematic, When instead of being firm, it's hard, and there's a membrane that covers it. The membrane should slide. So when you find out that the membrane is not sliding and the place is so hard, or even nodular, you might tell the person, I think this prostate have issue, and you start investigating from there. But not many people like this procedure. Okay, and you know why. So investigations, what are the common investigations we can do? We mentioned the digital examination is part of it. Ultrasound scan. What ultrasound scan will tell you is about, the enlargement. You can also do certain things. Maybe the density of the area of classification within the prostate. I want to tell you that, But when you're doing scan, sometimes after checking, they will say, you have to load yourself with water so that the bladder will be inspected, to be able to visualize the organ. They will say, okay, you come back, they will do it again. They want to check what quantity of urine is still left. If the process is enlarged, you find out that significant volume of urine will still be left, even after you win it. And that's a cause for concern. Because that significant volume that is left can be a source of bacterial infection. Because it's causing stasis. What's supposed to be evacuated is still remaining there. That's number one. Number two, if significant amount of urine is in there, it's causing some back pressure. It cannot come out because of the process that is enlarged. So the only way is to go back. If you are meeting a heavy traffic up front, what do? You revise, So when it's revising, when it's back pressure, where is it going? To the kidney. So that's sometimes somebody that have a large prostate for a long time might be having some issues with the kidney. I can remember one man that went to India. When the kidney failed, actually, and he went, he was thinking that, maybe they will do kidney transplant. By the time they investigated it, they found out that the prostate was enlarged, causing back pressure to the urine. So what they did was to relieve the prostate, restructure the prostate. And luckily the kidney, function, recover. You know what I'm saying? So it's not something you will just think of, is it just the enlargement? You can damage some other organs. So if the PSA, we'll talk about PSA, if it's high, ideally it's supposed to be 0 to 4. If it's high, then there is need to see a urologist. There is need to do biopsy. Women you are here, men don't take things so seriously. Why you are here is for you to keep pressure on your man, on your father, on your brother, on your husband, to keep the nature. Men you have the advantage over men because during antenatal and this thing, as you are taking children to hospital in one way or the other, you might say, okay, doctor or nurse, check my blood pressure. It's okay. You've had tetanus toxoid, you've completed the vaccination of tetanus toxoid. Some men have never had tetanus toxoid. So you have an advantage. Child here, you are in the hospital, taking babies to the hospital, you are in the hospital. So please, we want you to use that rich knowledge to, help your spouse, help your father, help your brother, Because if you wait, it's an adult, you should be able to help yourself. It doesn't work that way, So that is it. We do it gently. They say men should be taught as if you taught them not. Things unknown, propose as things forgotten. That's how we teach. Don't say you don't know this, don't know it. Say that they don't know. Say that again. Men should be taught as if you taught them not. Things unknown, propose as things forgotten. Things they don't know. Forgotten, we have for infection. Because the prostate is enlarged. Ideally, it's good to drink a lot of water. When you drink a lot of water, what happens? You go to toilet frequently, both male and female, and it acts as mechanical flush, But when you don't drink enough water, what happens? The urine becomes concentrated. Some people will say, my urine is changing to yellow. Sometimes it's a sign of dehydration. And you can see the weather is very hot. Even the sports, the alcohol, they play in the night. They will see some cooling breaks, and they play this in the night. You understand what I'm saying? So the immunity is high, and there's tendency for a lot of us to be dehydrated. And especially as we are getting old, dehydration becomes a very big issue. In fact, dehydration is one the commonest source of confusion in the elderly. Yes. And you think the person is sick and dehydrated. So try as much as possible to take water. And we hardly take water in this environment unless when we are eating. You hardly see somebody maybe deciding to see everyone with water and intermittently breathing. It's difficult to see. So please, it's important. We have to check the urine for infection. And I mentioned about the kidney function test because of the backflow, when the urine cannot go out. Okay. Now, the importance of autopsy. We are running on the importance of autopsy. I said in this environment we have need to do autopsy, and it's a very great disservice we are doing to the living because we don't have some complete history of what's happening in our family. If you ask somebody now what did their grandfather, what did their most of us don't know. You will see. They are the rushing to the hospital. And it doesn't help us that I believe So when we do autopsy, we'll be able to find out, okay, this is the cause of death, so that the living can be aware and do the needful. Okay, can you imagine? Autopsy finding from men who died from other causes. They died from other causes, not prostate related. But those that died in their 50s, they found out that 30% of them had cancer of the prostate. They died from other things. Maybe accident, this, stroke, this. But an autopsy, they found out that those that died in their 50s, 30% of them already had cancer of the prostate. And they didn't know. Those that died in their 70s, 80 of them had cancer of the prostate. And they didn't know. I'm sure, I'm not wishing anybody bad luck, but I'm sure one or two people, some few people here, are getting it without even knowing it. Because in most cases, it's asymptomatic, it doesn't have any sign. In most cases, it doesn't have any sign. When it starts getting complicated, then it starts advancing. Maybe it starts blocking the urethra. Then it's spreading to the bones and you start having low back pains. Even at that time, you might still be thinking that, okay, so what I said has brought water to you. Thank you. Well done, sir. Okay, so it's important. Autopsy, please. Let's try to talk to the elderly. Please, all this, don't take to the morgue. It's doing disservice to the because we don't know the cause of death eventually. Now, treatment. It's important for us to look at diets, fruits, vegetables. The ideal, almost everything. Fruits are vegetables. I don't know why we are running away from it. Fruits, vegetables, very ideal. Growing up, I know my mom gave me a lot of vegetable fruits, Fruits in the village, you bought anything around, what anything, the compound, whatever, here we should compound. In Lagos, it's a lot of money. You have to spend a lot to get it. But please note that healthy diet and food, fruits and vegetables is very important. Meat and dairy products. Please, milk and all the rest, please reduce. Reduce meat. Red meat is implicated in meat. Most things, even the cholesterol, So please, if you can step down on red meats, goat meat is better. Goat meat is better. Although it's more expensive. Physical activity is also very important. Physical activity. People will tell you that the greatest enemy of man is look at you. This is check. Please learn how not to sit down for too long. Even when you are working in your house, in your office. If you can construct something that occasionally you stand up and be working maybe on the computer, and maybe occasionally you stand up. Occasionally you stroll around. Please, it's important, you know. So physical activity, ideally for young men, should do 10,000 steps a day. If you are getting older, you can make do with 6,000 steps. You know, their speedometer, this is like wristwatch, you wear it. Yes, 10,000 steps a day. It's good to do. You know, some phones have speedometer, you can download it, but it's just that they might not be always in their pocket. I like the wristwatch one, so that when you want to sleep at night, you can look at it and check how many steps. Also, steps will be energy you want in a day, so it's important. And sometimes, fine, what we eat is important. But in the village, they eat a lot and they burn it down. You know what I'm saying? You know? But chair, with this chair, it's difficult for you to burn down the energy, the calories. So physical activity, surgery, you know, if it's enlarged, for instance, causing active rehabilitation, you have to do surgery. But before that, if you are having that issue, frequent nutrition, resistance and this thing, some of them will put them on drugs like others, cortisol, all of them, And when the challenging thing that one is sensitive to this current situation now, you have to keep on using it. But if you have to do laser surgery, in the case of a large process, you must have done with it. I don't need to use drugs again. There are some people, depending on the stage of the cancer, and that's why it's good to find this out early. Some people are going therapy, they take injection every 3 months, but some go for surgeries. Some might even do radiotherapy, chemotherapy. Depends on the stage. Has it spread, has it not spread, is it still within the prostate? There are a lot of factors that will determine, how the management is going to be. So we don't want it to take long. So quality of life. What happens if prostate is removed? There's difficulty getting an erection, what you call impotence and erectile dysfunction. You might also produce less or no semen, dry organs. You can imagine you have organs and nothing came out. I don't know whether it excites you. So that's why the women are here, If your husband has had a prostate surgery and all the things yanked up, this thing needs to be disturbing me. Yeah. Well, what can do the wife? They say you should take 2. It's either they continue like this, you will die and you will take care of the children, or you allow him to live and 2 of them will take care of him. So it's important. Sometimes when they do this surgery, some of them might end up with impotence, no erection. It's not something you're going to village with and start. You are not a man, because they feel less of a man even knowing that. Let alone when you come and put the pressure again. Because in the process of doing they clear everything. Because the testes, the hormones from the testes fix the cancer. So they are going to remove the testes. And in the process, some nerves might be hampered with, and you find out that no more erection. So it's a challenge. Even some people that have not done that, some of them on beauty drugs might have challenges in the erection. So is there any other way play can take place even in the absence of the erection? So that a man will still feel that I'm still a man, I'm not being looked down. But for a man, some of them think that they are being men because of their manhood. And one man I was talking to, he said that if you have a wound on the mouth and on the penis, that the means of enjoying wet has finished. I said, I don't understand that. So it's important that the women understand what they are going through and try to, maybe see this in program aspect. Because it can lead to depression. What are you having? One of the causes that can, and sometimes you have urinary incontinence. you know. So there's also fear of cancer, fear of all, is it going to come back again despite having, cleared all these things. So there's what we call penile or erectile dysfunction rehabilitation, and the aim is to see whether some level of erection can be achieved. But we are saying that when this kind of thing, I know this one now my legs on there and saying that I bet you I don't want to, instead of going to keep that and he gives me something else that will make me less of a man. Maybe, let me carry it. If I die, I die. No, please. It shouldn't be that way. Women, by the time they finish having their children, some of them, if they have issues with the womb, they remove it now, is it not? Do they feel less of a woman without a womb? No. So why should you feel less of a man without good erection? Is it a challenge? I want to know. Is it a challenge?
Oh yes, it's the challenge.
Is it a challenge?
Very big one.
This link, I don't know. If you can do it and feel it, so that you know their prostatic symptoms come. You have that. You can not get into this.
Error will get it for us.
Okay. So you have all this in at least check. The interpretation is there. If it is this, that means so that if it is at the level that you need to start thinking and investigating, you will know. But please, the main thing is that don't wait for signs and symptoms. Do the anal screening and you'll be fine. Thank you very much.
There's a round of applause for our something they are too young now, they don't need information. When I look back, 20 years like yesterday, you get to the age, but you also need the information both for yourself, or for your father, your brother, as a wife or your husband. That's why we said, when we're proposing the program, we said maybe our sisters should stay. We said no. Because sometimes they suffer the consequences when we were talking about erectile dysfunction and all of that. Now, if you have questions, you don't feel like asking openly, feel free to write. Some of the questions are almost personal. So I will start with my own question while you get yours ready. Now, we talked about autopsy. There are certain things that chase people away from autopsy. One, the trauma of death. This person don't die from it. You don't die, then you go bury it. That happens. Two, the cost. About 4 years ago, 10 years ago, somebody died and said, let's do autopsy to find like 150,000. My younger sister Rachel, when she died, that was 2002 or so. Say, what for? She don't die, she go, And then the general attitude, leave it to God. So what do we do about that, Dr. Neil? And then there is this fear of surgery, men who have prostates. Deep fear. In fact, all these aspects we talked about now, I didn't know. That it leads to those consequences. Because usually when it's enlarged, that is it the BPH? BPH. That's the non-cancerous one, but it's enlarged. They are told go and do surgery. Alright? So are you saying if you do that surgery, you also suffer these consequences? Then, we talked about laser. Perhaps you can advise us on laser treatment, where to get it for men who are interested. Then as a branch, we have decided we are going to do PSA screening in this branch. So, brothers who are interested, write down your names, and maybe become below the cost to appeal to Dr. D to arrange it whether the branch can subsidize. When I did my default, I think it was 17K if I'm right. I did it at Adebusu, SET there. So, we will subsidize. There are also sisters. The next health talk will be on breast cancer. And when is it your brothers will be here? Because they say brothers here are the first doctors, they don't know why. So those are the questions. One, autopsy because then.
Brothers must be around.
Yeah, that's what I said.
Men also.
Well, that's what I said. I said brothers will be around.
Why you say that? Because they are white. The men also do have CA.
That is true. Like men who have big breasts.
No, it's not that happy.
The normal one.
Yeah.
Anyway, the doctor will address that. Because my own people. There are some words that are said in this hall today that never be said here. But these are things that affect our lives. And we should feel free to discuss them. Yes. So please, autopsy, the cost to this leave it to God, and then the trauma, and then surgery. Those consequences. Thank you. Over to you, sir.
Okay, thank you, sir. Autopsy, the cost. Cost-benefit analysis. I think when we look at it, time is costly, so to say. But when we look at the advantages we will gain from it, I think it's important to push for autopsy. Because it's something that goes beyond their generation. At least we know that, okay, this is what happened. And also, it gives us the relief that when in the village, we're thinking that it's the other person that killed the other person. You know? So, this juju kind of something, it can also give us some this and that. Oh, I don't think it's so. So, please, the cost benefit analysis, I think it's cost to find, but let's push based on the benefits. Fear of surgery, everyone is afraid of surgery. There's something they say in surgery, if you see things outside, by the time you enter there, you might see 5 things. You know? So that's why you have to sign before you go in, because you don't know what the surgeon is going to encounter by the time you open some. So it's not guaranteeing you 100% that or we will give you high level of assurance, nevertheless. But fear of surgery, I know, but we started doing it here. You have to counsel the psychology, prepare your mind, and then tell you all these consequences. It's good for you to know. Because some nerves are too small, and when you map out, even without with age, the level of physical activity reduces. With age, even without age, with age, it reduces. A lot of worries, whether your children are being well, activity, whether or if I retire now, what am I going to do? So many things, and all those things. It flows from the brain. And that's why you see some young men can go 10 rounds and this. When they are getting older and they are becoming with a lot of, sometimes in 3 months you don't even remember this. You know? So that is it. Please, fear of surgery in a good place, they should be able to counsel you and give you some quality assurance. Safety for surgery for BPH, yes. It's important because if you do it, it's going to get worse. Laser surgery, I know a lot of people are referring to usage. I know they started quite laser surgery. They don't know before what they do for prostate because open. But now they don't need that open surgery. They don't need a cut. So, and it's less invasive, but it's more expensive. That is it. And the last time it has entered 1 million was at stage. I don't know how much it is now. I don't know how much it is now. But it's something that most people that did it there, I can't see much complications. At least they are done. By the time they are buying the drugs, go back now. People that are using it will tell you how costly it is. By the the time you buy that for a year or 2 years, you might likely pay for that surgery. That when you do it, you don't need to cross again. So please cost benefit analysis. Thank you, sir.
Thank you. More questions, please.
So that's okay. Intended purpose. What to check? I think it's a good question. So it's a little bit beyond the scope of things. It's a large topic on its own, but sometimes there might be a lot of mistakes. And I think a lot lies on the intended purpose to sit down and tell themselves the truth. Because I'm seeing a scenario whereby somebody that is impotently revealed, got married to this lady and kept on taking a cheap insurance and trying to escape the bed and eventually the day is up to them. So there's need for the intended couple to get confidentiality. If I know something about an intended couple, I can only empower the person or counsel the person to tell the would-be partner, the would-be wife or would-be husband. I shouldn't go at the back of the person to reveal the information. It's against the go to a work. So it's important. Intended couple, sit down with a bottle of water, tell yourself the truth. Because we might not be able to break certain truths that we know, to because of confidentiality. So that is it. And then exercise, everybody is supposed to do exercise. When we were small, our parents would sit on the floor and say, before you drive, you should go to market and buy this thing and come back. They didn't know they were training us for exercise. Everything, we are running for everything. We run to the street, we were not especially running for it. And it really helped us. So right from tendering, we were involved in sporting activities, and this is another thing. So there's no day that you need to start saying, okay, start exercise. No. Even from tendering, allow children to explore the environment as part of exercise too. So there's no aid to that. Somebody brought something I was hearing before too. Is it true that frequent sex reduces the chances of the last week also asked about prostate cancer, frequent sex? Well, some things are in the realm of discussion yet. In medicine, before things get to us, we do clinical trials. That's the highest level of research. Testimonies is not enough, it's not permitted. And that's why some of these drugs, we take it as testimonies. So we use it to do fine. Sometimes we also use testimonies to treat people. When you discover so much, you're high, you put water inside your eye as a drug. In the morning, you go place you, that medicine will go to your eyes. It was so good. We call it placebo effect. So testimony, do we now start selling water as drug? Or somebody has given that testimony. So it's still at the level of testimony. By the time it's gazetted as clinical trials and goes through clinical trials and there's now evidence-based, you don't do things. I can't prescribe this, for instance, because it's not in a drug formula. There's something. If you ask me, I say, okay, if you medicine have to take it. But I will not write it as a prescription. I will not write it as a prescription. What get the next day I saw it or I can't defend it. So that is it. Then prevention, yes. Prevention is better than cure. Food, vegetables, do the right thing. I don't want to go to another issue that young people will have that starts, when you get infected with sexual transmitted infection like, gonorrhea, and you didn't treat well, and you might end up with urethral stricture. That one is a different thing. It's like a urethra, when I showed you, it just comes, stricture. Finally, you cannot pass urine again. It's not that the process is enlarged. This one is infection that was not treated. And I find out that the opening now, is narrowed, So that one it presents also similar to this, but the process is fine, and it's in younger people. And the problem about it is that might come up in 10, 15 years time, by which time you would have even forgotten how you got it. So please, it's important, once you get any infection, get it treated. So fruit, vegetable, any stages, alleviation, any stages, once you get it, do screening. If you do screening and find out that it's tending towards enlargement, what you do is that if it's not disturbing you, we allow the symptoms to lie. Some people have a enlarged prostate, but they are not having symptoms. You know what I'm saying? That's why we involving them with drugs. Because in the next 5-10 years, they might still not have symptoms. You know what I'm saying? If they say prostate is mild to moderate enlarged, they might not have symptoms. But those that are having symptoms of, you find out that the urine, all those things I mentioned, visiting the toilet frequently, you get to the toilet, the thing comes now, it's wasting time again, it's dropping at your shoe, you finish moving, it's as if some are still left, feeling of incomplete empty. Those ones will not put on drugs or medication. We can now advise them, well, you are complaining of the cost of medication, why not go and see a neurologist? Maybe you assess, do lesser surgery so that you forget about this medication. You know what I'm saying? Okay. So, any correlation between scrotum or I think what you're asking about is testis and prostate. Because the hormones from the testis feed the prostate, and that's why sometimes once they want to do prostate surgery, radical prostate surgery, they clear the testis. They remove the testis. That's what I'm saying. Yes. They don't want that hormone from this to keep on feeding the cancer cells. So they remove the testis. And they usually get, I forgot to even add that prostate is one of the most rewarding cancers to treat. I've seen people that have cancer of the prostate for over 25-30 years, and they're still doing fine. It's not that they're on bed or this, they ain't going on. They're still doing fine. So it's highly rewarding, and that's why it's important to pay attention to it. Because it's not something you think that is a death sentence. Okay, erectile dysfunction, is it in all cases? It can't be in all cases. There's catch-up questions when we're in school. We say, this thing happens in all cases, just mark first. Not whether you know it or not, mark first. But there's no way in all cases, But in a lot of cases, because the nerve might be tampered, and like I said, there's no really prostate issues that come with erectile dysfunction. Age alone, as they are aging, you find out that their performance is reducing too. And then sometimes you have to be careful about second wife issue when you go and take a younger person. It's not an easy thing. I've seen it and it's like, why do you want to commit suicide? Somebody that is just coming all back. It doesn't gel at all. So please, you have to work on those areas. You have to work on those areas. And because sexual performance reduces with age, you have a lot of worries. Apart from some drugs, yes, different drugs. For instance, we hardly prescribe abdomen for men because we know that they want their inch flat. And then some diuretics too. But sometimes the BP is so high and we've used drugs have classes. We've almost touched all the classes and this BP is not coming down. Let's even save life first. After we start talking about regeneration of this one. So sometimes we say, okay, we'll use all the classes. Can we bring our domains? Bring this thing down first. And then later we'll now start talk about rejigging the architecture of security systems. We also rejig the architecture of the erectile dysfunction. But those drugs that once you complain about the drugs, we change it. That is, once you complain. So people don't mind. Once you complain about it, we change it. So it's not in all cases. In some cases, some people can still perform. There are some people they didn't do surgery, they didn't have any prostate. Too much, you can be very religious and the thing goes off. You know what I'm saying? Yes, it's just very ridiculous. You want to go to heaven. To think, yes, and it's not, you are not bothered. You know that it's part of it. You know? So that's it. A lot of things can cause it. Prevention, BPH, only thing surgery. Only thing is not surgery. The only thing for a life process is not surgery. A lot of people are on drugs. My prof said a lot of people don't want to go for surgery. But there's lesser surgery, but it's less invasive. You know? And you can do it and then have their health. Rather than spending every month on drugs. Because if you're on those drugs, you have to take it every day until you decide one day to do the surgery. You know? And it's quite expensive. So, anti-cellular life, I think I've answered it earlier. Whether you have anything to do with the reduction of prostate cancer, it's still at the level of discussion, like I said. When they roll it out after getting trials, you know, and then possibly by then. But active, how active? Did they tell you how many times? Did they tell you how many times? You know that it's a low area. You know? Watch your heart also. Your heart is very important. Please.